So here we're looking at total confirmed COVID-19 deaths. How rapidly are they increasing? And the key thing is the steepness of the slope. So we see that in the United Kingdom, Canada and the United States, things went up quite dramatically to begin with before the lockdown measures came into effect. But what I want to look at now is where we are now. So the thing to do is with these, and of course I'll put the link for this graphic on, it's Our World in Data, is to look at the sort of trajectory that we are on. So lining up the last few data points there for the UK. And I'd say the UK is heading for that sort of trajectory at the moment. Maybe see that better in a different colour. Now, having said that, we know that the deaths in the UK, the increase in number is getting less. So we would hope the lockdown measures actually, rather than following on with that trajectory where we are now, we would hope that that would start to level off and fall. That's the hope. Now, the United States has done reasonably well in levelling off the curve, and I would say, trying to be as honest as I can, the trajectory for the United States is somewhere around about there. So I would say that's following on that line. With the similar measures to where we are now, you would expect some increase. But as we'll talk about today, I am remarkably concerned about the easing of lockdown measures in the United States. Therefore, I fear that we may be going higher in the United States. This is my fear, that the death rate could start increasing again. And if we look at Canada, here we have Canada. Now, again, being as honest as I can with this line, in Canada, I'd have to say that now the rates seem to be increasing on this graphic. Slightly more steeper rate than the US and the UK at the moment. And of course, where that line goes will very much depend on what Canada does in terms of its lockdown measures. So I thought that was quite interesting, those graphs. The trouble with world data is you go on there and it is so interesting that you can spend absolutely hours on there. Now, welcome indeed. It's still the 6th of May, Wednesday the 6th of May. Now, to look at the United States here in a little more detail. Now, the United States, the confirmed number of cases, 1.2 million. 71,000 deaths in the United States. And as I've said, my great concern is that this could well carry on increasing because of the current attitude to the lockdown measures in the United States. And just to illustrate that, I want to just read an email from someone in the United States. Now, you probably heard this story if you're in the States. A security guard in Michigan was actually shot and killed for telling a woman to wear a mask in a retail store. So obviously that descended into some sort of incident, but really very concerning that sort of thing could happen. Because the wearing of masks in retail stores is mandated by the governor. So, if you're not going to do what the boss tells you, then what's the point in having a government? This is a state where there's been a lot of protests. And the governor has been abused for trying to instigate the lockdown measures. Don't know the politics of the situation. Don't even know whether it's a Democratic or Republican governor, to be quite honest. But slightly concerning that could happen when it's been mandated at state level. In Texas, where I live, the governor has been reopening the state. Parks and retail stores are open. People seem to be acting as if life is going back to normal. My neighbours threw a huge party last weekend. The dog park was full of people not socially distancing. And the lake park's car park was jammed full. The lake itself was so crowded with cars, I assume that's the car park, was so crowded with cars, people couldn't even drive through the park road, no masks anywhere. So that sort of thing is concerning, and that's why I'm a bit bit worried about this purple line, that it could end up going up in the United States. Now, interesting things from the States as well. A human vaccine trial has started on manipulations of the genetic code of the virus. Now, I must say that's a completely new one on me, but the scientists there are obviously confident enough to start it on human volunteers, and they seem to think it could potentially work in just a few months. It could be available in 4 months. Now, I'm not going to talk about it now because I don't pretend to understand it, but I will check that out. But it seems a completely new approach to vaccination they're being taking in the States, so we'll watch that with interest. And if that works, that would just be absolutely brilliant. Now, a lot of people are worried about meat shortage in the United States. Don't worry about meat. You can get by without meat fine for a period of time. You can eat lentils and beans. Don't worry about that. Now, New York State, and this was an unfortunate story. Another 1,700 deaths disclosed at care facilities in New York State. So, as we mentioned in the previous video, in my country, Canada, America, everywhere, care homes have been so badly affected, as we indeed have feared for a long time. And Canada, we are slightly concerned about the trajectory. So at the moment, the current trajectory in Canada for increasing deaths is slightly steeper from this graphic than the United States and the United Kingdom. So signs for concern there in Canada, but again, it's one we'll watch with interest, as indeed will every Canadian, I'm sure. Now, moving on to excellent news, New Zealand. Now, the death rate in New Zealand had been particularly low. And I think this just shows the importance of realising that the deaths lag behind the cases quite significantly. There's this lag time, because it takes people quite a while to die very often after they present with symptoms. So the death rate in New Zealand up to 1.4% there. But still, as far as I can work out, no confirmed or probable cases for 2 days, no deaths for 5 days, 4 people in hospital, and they are testing, tracing, isolating, this new strategy, or TTI, that is now realised to be the way to go by most countries, as if we couldn't have worked that out weeks ago from watching South Korea. Now, from good news to distressing news, no other way to put it, Russia. Cases and deaths increasing, of course. They've been increasing rapidly of late. Now, apparently the Russian hospital system and the Russian health service has been undergoing a process called optimization. Now, this is an example of what you call a euphemism. It actually means a lot of things are being closed down. And this is nothing short of utterly alarming. 3 medics in Russia, don't know whether they're nurses, doctors or what they are, but there's reports that 3 medics have fallen out of windows, I believe, in the past week. Now, you don't need me to comment on this. I've been working in healthcare provision and education now for 42 years, and I've never known any member of staff fall out of a window. We did have a patient once who jumped out of a window and was tragically killed, and another patient that, anyway, you don't need to know the details. 2 patients have had accidents with windows, but I've never known a nurse or a doctor fall out of a window, and I've never heard of it either. So that is utterly alarming if this is being used as a control strategy in Russia. I believe 1 is critically injured and 2 are dead. Say no more about that. Not good, not good. Now, Thailand is remarkably interesting, because it may be that we've all got a lot to learn from it, but I'm not quite sure what the message is yet. Now, the cases and the numbers are relatively low, and yet we were reporting on this Thai taxi driver who caught the virus from a Chinese tourist. Oh, way back. It's one of the earliest things I reported on. So spread to Thailand was very early. So why isn't it spread greatly in Thailand? Well, it's a good question. Now, I've been talking to an Scottish doctor who's actually in Thailand at the moment. And these are his observations. So people spend much of their time outdoors, are a fairly light skin colour, and therefore probably not deficient in vitamin D. So that was this British doctor's thinking. Also, he said wearing face masks is almost universal. Now, I used to work in Thailand a long time ago with the Cambodian refugees, and wearing face masks is just part of the culture. People very often wear face masks. Same in many places in Southeast Asia. It's a common part of the culture. In Cambodia, it is very common. Whereas in the UK, I think part of the problem that we haven't been wearing face masks when we should have been is this cultural barrier to it. People in the UK find it difficult to wear face masks, but in Thailand, it's just normal. You know, Japan as well. You got a cold, you wear a face mask, normal. So I think that's probably been quite a big factor in preventing people that have the disease spreading it to other people as well. So the vitamin D in the face masks. Now, everyone has their temperature taken. This doctor says, okay, not the best screening, but easy to do, which is true. You just use one of those electronic thermometers before being allowed into a shop or a mall. Now, of course, you could fiddle this by taking paracetamol, acetaminophen, Tylenol, ibuprofen. But it's better than nothing. People getting the temperature tested. Doorman meets you at the entrance of a shop supermarket to squirt alcohol onto your hands. Now, this is excellent. Now, in the UK, the alcohol's available. But in Thailand, someone's there saying, "Oi, take this, mate. You're having this hand sanitizer." Because I believe hand sanitisation is very important in public places. Shopping baskets are cleaned after each use. So you see, these are very simple strategies. You know, are these the simple things that are making the difference and have prevented great spread in Thailand? And this is a doctor on the scene thinking about this, and so we have to listen to this. In Phuket, at least, there is little public transport. Most people travel around on mopeds and cars. Now, every time I've done a few teaching trips to Cambodia, and the first thing I do is go hire a little Honda 125 or something for $5 a day, because everyone gets around on little motorbikes. It's absolutely universal. Or push bikes. So little use of public transport. And of course, push bikes and motorbikes are in the fresh air. They're not in cars sharing with other people. They're not in buses and trains sharing with other people. They're either cycling or on their little moped or small motorcycle. Interesting. The authorities isolate known hotspots. So there's been good isolation of known hotspots. And they test everyone there. So targeted testing. As in South Korea, targeted testing. Then you can have targeted tracing. Then you can have targeted isolation and quarantine. Now, this guy's just in Phuket, but we assume that's happening in other places as well, so also good. Each case is given a number and information is published, so it's made public as to which positive cases are and presumed to have contacted people that are presumed to have contact with that person. So this is kind of put into the public domain so you can look up people and see if you are at risk. Now, I know people are throwing their hands up in horror all over the place, but it does appear that Thailand has got low numbers of cases and low numbers of spread. A chain of infection can then be worked out. Interesting. A recent spike of 18 cases yesterday was due to a group of migrant workers. I only got this email yesterday, so that must have been the day before, who were in quarantine. So migrant workers were quarantined when they arrived. So hopefully that is completely contained because of the quarantine strategy. Now, I got this. So that's what that doctor said. So all very interesting and all well worth serious consideration for everywhere. This is why it's so important to compare places internationally, because we can work out what some people are doing right. And very often the best interventions are not expensive, they're not high-tech, they're dirt cheap, just a matter of instigating them. Like having someone at the entrance to the shop squirting hands with alcohol hand cleanser when you go in. And this is a different email I've got, but also from Thailand. When the outbreak occurred, they switched off the aircon in the school my daughter teaches at. Remember the Diamond Princess? We were suspecting the aircon. We know that virus can be aerosolized and spread around in the air. It's an airborne virus. So they switched off the aircon. Dead easy. Opened all the windows. What we've been saying for months. Open all the windows, dilute the virus, and wear masks. So turn off air circulating systems everywhere around the world. Open all the windows and wear masks. It's not expensive. Why isn't everyone doing this? I don't know. Open the windows. What's difficult? All public spaces need to be well ventilated. People need to be clean. People need to be wearing masks. Stop the spread in shops. Stop the spread in public transport, or massively reduce it. So Thailand there, not a rich country, instigating simple measures, targeting its testing, greatly reducing the transmission. That deserves respect and consideration. Now, India, starting to ease the lockdown now out of pure economic necessity. We know these figures aren't, well, cases have been increased by 4,000, so there is some testing, but shops are reopening. There was a big run. Apparently you haven't been able to buy a drink in India for 40 days. So there was a big rush on alcohol shops when they opened yesterday. Actually, it's quite serious. I have done some work in India, and alcohol is a major social problem in many areas, poor areas of India especially. Now, Bangladesh in that part of the world, another source of quite major concern. Cases and deaths, again, this bears no representation to reality at all. We know there's community transmission. It's spreading from person to person in Bangladesh now, as you watch. I mean, at this time, we know that's the case. So this means there'll be an exponential rise in the cases in Bangladesh, unfortunately. Dhaka is the epicenter at the moment, but it is spreading out to rural areas. A bit like the United States, to be quite honest. I mean, it started off in cities, and now it's spreading to the rural United States. And the same is happening in Bangladesh, spreading out to the more rural agricultural areas around the cities. People are going back to work because they have no choice. If you're looking at hungry children, you're going to go back to work. 50, maybe 80, 85% of people will get mild illness. They're prepared to take the chance. 15% will get quite ill. 5% can get critically ill. And because of the lack of affordability of health infrastructure there, the case fatality rate could well be well above 1%. Lockdown's officially till the 16th of May, but factories are reopening. And I've seen there's a lot of garment factories in Bangladesh. Now, I don't want to get started on this, but the amount of new clothes that are bought and discarded in the UK, in Europe and the United States is just appalling, because most of them are cheap because they come from China and Bangladesh and Vietnam. But the conditions in the factories are not good. I watched some video footage this morning from Al Jazeera, and the conditions were very crowded and the ventilation was obviously poor. What do you think this means for spread? Well, you know as well as I do, it means the spread of the COVID-19 virus is simply guaranteed. It will happen. Now, another major concern, we highlighted this recently, but Cox's Bazar, southern Bangladesh by the sea, near the Burmese border, there's 1 million refugees there. Now, thankfully, in the refugee camps in Cox's Bazar, there are no cases, but there's 1 million people very close together. So Bangladesh is supposed to be locked down, but we know it's not. Cox's Bazar is largely locked down, but there are some comings and goings. So let's hope the spread can be kept out of these million, mostly Rohingya refugees in Cox's Bazar. Let's hope they can be spared this pandemic for a long time. They're going to get it eventually, of course. It's a pandemic, unless the vaccine comes first, but I can't see that's going to happen. Let's hope that many people take time to thoroughly prepare for the arrival of this virus in Cox's Bazar, as it will inevitably come, and take all the mitigating circumstances that we can possibly take to help these 1 million most unfortunate people at the moment. Now, just before we finish today, I was just browsing in our world in data, as you do, and I just came across this really interesting global slide that I'm going to show you. Now, these are coronavirus early stage case fatality rates by underlying health conditions in China. So this was in China. So within the few weeks we should have probably very similar graphics for the world, and I would expect them to be similar. So 10.5% of people with cardiovascular disease who were diagnosed with COVID-19 died. In other words, 100 people with cardiovascular disease were infected with COVID-19 and 10 of them died. That is concerning. Same with diabetes. Mostly type 2 diabetes in China, but some type 1 as well. What the difference in mortality rate between, or case fatality rate between type 1 and type 2 diabetes is, I don't know. I've never seen any data for that yet. We'll certainly keep an eye open for that. Now, that's a question I've been asked many times, but I haven't seen any data for it yet. Of 100 people with chronic respiratory disease who contracted the virus, 6.3% died. Blood pressure, high blood pressure, hypertension 6.3, cancers 5.6. Compared to those with no health conditions who are otherwise healthy, 0.9%. So we see clearly that increasing age and comorbidities are significant risk factors. Okay, that's the end of today's video. Now, I've had a really strange question, so I'm going to answer it now. It's about this sheep in the background, so I'm going to go and get him. I think he might be a vet. He's got a stethoscope. Now, actually, we see now he's actually not a sheep. He's a dog. And he's Winston, the black dog. Now, some of you got it immediately. But Winston Churchill was a war leader in my country, and he had episodes of what he called the black dog came upon him. And the black dog is depression. So Winston used to get depressed, and yet did many impressive things in his life. So this is just kind of a reminder that depression can be an issue for many people, I guess. But it can be worked through. There are treatments. And this was a ride out me and my son did on a bike ride for raising money for people with depression. So that's who he is. So don't call him a sheep, you'll be offended. He's a dog, okay? But he's a black dog. Right, okay, let's look at a few pictures today from people who kindly watch all around the world. There we go. Now this is Rachel, who's a great mask maker. So a little bit of imagination, and look at all these masks she can make. So no excuse for not making masks when we have people like Rachel in the world. I wonder if Rachel's done a YouTube video to tell people how to make masks. I'm sure there are many, many. Very, very nice looking masks. So I think that's great. Oh, Rachel's in Ottawa. Here we see her workstation. So thank you, Rachel, for sending those in. We need to wear masks in public. Now, this is, I'm going to pronounce your name wrong. I'm sorry. Rendua in Togo. So great to know you're watching out there in Togo, and a very nicely decorated laptop you have indeed. Great to know that it's really lovely to know people are watching around the world. It's great. This is Richard from Bloomsbury in London. And he's got some vitamin D, 25 micrograms, which I believe is 1,000 units. So I'm taking 2 of those a day. But thank you for watching in London, Richard. Good to see you. This is Rita in Australia. Good grief, Rita's got 4 of me. 5, heck. 1, 2, 3. We appreciate it, Rita. Thank you very much. Good. Rita in Australia. Oh, that's Rosemary's mask. So Rosemary's making masks as well. I think these ones were lined with something. So lots of things you can do. Better than not fabric mask. That's Rosemary's masks. Yeah, that's Rosemary's masks. Now, this is appalling. I've got a screenshot here, and I do apologise. I haven't got your name. Isn't that appalling? Anyway, I'm delighted you're watching. I do apologise for not writing your name down. But thank you for watching. This is Sean, who's in Hampshire. Some sort of a space invader thing there, I think. This is a thing about someone's made that to remind us to protect our seniors, which is good. This is Sean in Hawaii. Quite a few viewers in Hawaii, so good to know people are watching in Hawaii. Thank you, Sean. Good to know you're there. This is Stefano from Florence, beautiful city of Florence. Amazing art galleries. North Italy, Florence. Good to know you're watching there. This is Susan in Toronto, Canada. A lot of my viewers seem to have dogs, which is great. I like dogs. Okay, that's us for today. Thank you as always.